Good afternoon, Long Beach, and we of course are going to do our COVID update like we always do. I want to just start by saying a few words about what's going on right now in Washington, D.C. I think it's no question that what we're witnessing today on our televisions and on our computer screens is sickening. It's horrific, and it is not who we claim to be as a country. I think most of us have been angered and saddened. I have been by the actions of really what is an attack on the Capitol building in D.C. And it's also it's really disappointing that leaders in this country, including the president, cannot use strong words to denounce what is happening in our nation's capital. And I think that for us to not be able to condemn those actions in the strongest terms is really a sad day. This is a day that we should be closing out our democratic process for an election. And so I want to just send, I think on behalf of everyone in our city, the most love and support to all of the staff that are there, all of the members of Congress and others, including our very own members of Congress, Congressman Lowenthal, especially Congresswoman Nanette Barragan, who represents part of North Long Beach. Our thoughts and love are with them, their staffs, and everyone at the U.S. Capitol. I also just want to add that this is a serious day, and the Long Beach Police Department and our city team, of course, have been in conversations throughout the day and are monitoring city assets, our regional assets, are working with our federal partners, and are ensuring that Long Beach remains safe. We have kind of increased our monitoring presence, and we are closely watching not just what's happening here, but also what's happening in D.C. and across the country. So that will continue, and we will get past this. Hopefully, the sooner the better. But while this is all happening, we still have a massive crisis as it relates to COVID. But we also have an opportunity, and that is to vaccinate as many people as possible. And so we're having this today because I want to make sure that we get you as much information as we can around vaccinations, first and foremost, what we're doing, how it's going, and where and what's next. And so I want to talk a little bit about vaccinations. And then we also have our director of our health department, Kelly Colopy, who's here, who'll be able to also talk about what's going on with COVID, but also answer some great questions. So we'll do that at the end. So let me start with our vaccine rollout. First, as most folks know, while the state certainly is guiding the city as part of a region as it relates to the reopenings and the economy, our health department is doing its own vaccination process, just like we're managing our own testing process. So we in Long Beach manage our testing operation, which I think for the most part is stellar, and one of the best, by the way, I think in the state and the country. And we're managing our vaccination process, which I also think is actually going very well and much better than some of the horror stories I think you're hearing about in other places. So, of course, we've discussed this now for a few weeks. We are right now at the tail end of Group A. Group A, of course, are our hospitals, our clinics, our healthcare facilities, nursing homes, including the staff and those that work there, our paramedics, those that are EMTs, which many of them are firefighters. That whole group is Group A, with essentially our medical teams, our doctors, our nurses. That group, our goal has always been to finish. We've talked about this as hopefully around January 10th, January 11th, as we start our Group B, which we'll talk about in just a minute. So far here in Long Beach, we know that we about 75% of all of our workers in our hospital system have been vaccinated. That we still have about 25% approximately that have not received their vaccination. And you are hearing some stories of some folks that may not want to receive it. That's the case everywhere, including here, and others that have not yet received their vaccine or have not yet been able to get their vaccine are in that 25%. The bright spot is that number is actually much lower than what you're seeing in other parts of the state or the country. We're seeing some counties where it's 50% of their hospital workers. And so we're going to work to get that 25% still vaccinated, but we are at 75% of our hospital healthcare workers, and we're getting through all of our clinics and nursing homes and all of the rest as well. So we are thankful for that. We also want to let folks know that we are concluding and vaccinating all of our paramedics and our paramedic units, our firefighters. We have partnered with our pharmacies like CVS and Rite Aid that are going into our nursing homes and vaccinating. I'm hearing stories back from doctors and workers at our nursing homes who are just so grateful to have been vaccinated, and I'm really grateful to hear that as well. Now, we've been hearing a lot, and we've always expected this. There have been some clinics that are saying we haven't heard anything yet, or some small medical offices that may say we don't have access to the vaccine, or we have not yet gotten our doses. That's okay. We are still in Group A, and I'm going to tell you today how we're going to close that gap. And it's important to note that this is not a perfect process. We're trying to get through everyone as best that we can as the vaccines come in, and they come in weekly. So we vaccinate as vaccine shipments come in. We are not sitting around and waiting. We're vaccinating every single day, folks in our city. So if you are a clinic, or you have a small office, medical office, you're part of this group and you have not been vaccinated, or for whatever reason your employer or your place of business doesn't have access to vaccines, there are two ways to get vaccinated. So we want to get all of you vaccinated immediately because you are in Group A. The first is you can email COVID-19 vaccine at LongBeach.gov, or you can call 570-INFO, and you can press number 6 or just hear the prompts. So call 570-INFO or COVID vaccine at LongBeach.gov. That is the best way if you are a clinic or you have a medical office to get your batch of vaccines, or so that we can schedule a vaccination clinic for you. That is the first way that you can get your vaccines. The second way is we will be beginning next week to host vaccination clinics for Group A. So if you work in a clinic, you are a medical worker, you are providing medical services, and you have not been vaccinated and you're starting to get worried, no problem. We're going to take care of you, and those clinics begin next week. How do you sign up for a clinic? You email the email I just mentioned, COVID-19 vaccine at LongBeach.gov, or you call 570-INFO. When you go to one of these clinics, you will need to show proof of your medical place of business, that you are a worker at one of the clinic or a healthcare worker. And almost all health workers across the city have some type of identification. So vaccine clinics begin on Monday of next week, and we're going to continue to roll out the vaccines for Group A. So if you're in Group A, I know a lot of folks have been stressed. You can get a vaccine. It's going to be available to you. Sign up. We're going to get you an appointment and get you vaccinated. So that is information we hope also our friends in the media will get out so that we can finish up Group A. And just because we're about to start Group B doesn't mean Group A is done. So if for some reason you couldn't get your vaccine and now we're starting our essential workers, a group never closes. So once we open up Group A, that group doesn't close when Group B starts. You can still get your vaccine as we go into Group B or Group C. So that continues. Now let's talk about the next phase. And as we go into this next phase, one of the questions that we're getting for Group A and Group B is, what if I am a Long Beach resident, but I work at a clinic in Orange County? So the answer to that is we want to vaccinate all Long Beach residents if we can assist you. We would ask that you first reach out to your medical place of work and see when they're going to vaccinate you, because really it's the place of work that's supposed to do the vaccination. But we also understand that we're not going to leave any person in our city behind and unvaccinated. So my message to you is, if you are a Long Beach worker, a resident of our city, if you're a Long Beach worker, you work here, you're going to get vaccinated through a clinic. But if you live here and you work in Orange County or in LA, or somewhere in LA County, or you work somewhere distant, and your place of work, for whatever reason, hasn't vaccinated you yet, we will vaccinate you. And so please know that the number I just gave and the email is available to you if you are in Group A and you live in Long Beach or you work in Long Beach and you're a medical worker, please get your vaccine. Now let's transition to Group B. Starting, we've always said that this group would start the week of the 11th. And so starting on Thursday the 14th, we are beginning Group B. Group B includes teachers, our educators at Long Beach Unified, Long Beach City College, Cal State Long Beach, and our private institutions in the city. It includes our grocery workers who are working so hard in this pandemic, certain food workers, and it also includes city emergency management personnel, key folks that are operating our emergency operations center within the city of Long Beach. All of those folks are part of Group B. So on the 14th, and for the weeks that follow the 14th, we're going to be going through all of those groups. That doesn't mean that everyone's going to start getting vaccinated on the 14th. It means we start on the 14th. And so, and how will this work for these locations? So, if you work at LBUSD, Long Beach City College, or Cal State Long Beach, please know that you will be contacted by your institution. Same for the private schools. Your institution should be getting you information about how to get vaccinated. Now, we're partnering with the institutions, but many of these vaccinations will either happen on campus, or in some cases, it will happen in some kind of clinic that we will be hosting as a city. But please stay tuned for information from your place of work, which will be sometime after the 14th. Same goes if you work at one of our grocery stores, you work at Ralph's, you work at Vaughn's, or you work at a place like a small place, little market like the Crest Market here in downtown, or Trader Joe's. You will get vaccinated, likely by being contacted by your place of business. Now, your place of business might say, well, we haven't received information yet. That's okay, because you will get your information by the 14th or on the 14th. So if you haven't been contacted yet by your school or your place of work, that's because we haven't started this phase, which won't start till Thursday the 14th. So please just hold tight. Also, we will begin sometime after the 14th in Group B, vaccinating people over 75, which is a change in the state guidance that have been moved up. So if you are over 75, we encourage you first to contact your health provider, whether it's a Memorial Care System, whether it's Kaiser, whatever your health provider is, contact them, and they should be able to help you get your vaccination through your normal medical process. However, if you don't have a medical system, or if you are having trouble with your system, and you are over 75, we will also be hosting these special vaccination clinics where you can come and get that vaccination. I believe also those vaccination clinics will be held in locations across the city. We don't have information to report yet as to when those will start, but we will announce hopefully those on the 14th and give a broader idea. So again, if you are a teacher, educator, health provider, those start that week, and we'll go for weeks after that. And please also remember, if you are, and we've heard this over and over again, you are a Long Beach resident that works for Los Angeles Unified School District, or you are a Long Beach resident and you work at Cal State Los Angeles or at UC Irvine. First and foremost, you should be getting vaccinated by your institution. So they actually have been assigned your vaccine. That's the way the state has broken it down. But please note that if you end up having trouble with your institution or you don't get your vaccination, we're not going to let you go unvaccinated. And so if you are a teacher that lives in our city, or a grocery worker that lives in our city, works elsewhere, at some point in the next few weeks, we will host these clinics and you can come in and get vaccinated. It may not be right on the 14th, but we will make announcements about when you can get vaccinated as well. So no one's going to get left behind. everyone that wants a vaccine, and I hope that's most everyone, will get a chance to get a vaccine. And that is all the information we have to share as it relates to Group A and Group B. Now, once we're done with those groups, we'll be moving on to the other groups. But please note, and this is something that's really important, vaccines require 2 doses. So it's not like we can just zoom through all the vaccines. Once we get through Group A and Group B, we're going to have to then start going back and revaccinating Group A and going back and revaccinating Group B. And that is going to cause us to not go as fast as we would like because the vaccines aren't coming in as fast as we would like. And so just please know that the timeline that we gave maybe a month ago is still the likely timeline. General public vaccinations are likely not going to start till much later in the spring. It could be early summer where we're seeing large vaccines, and that's all dependent on how many vaccines we get from the federal government. And we know right now that they are woefully behind in sending vaccinations out to us. If we had all our vaccines, now we would be vaccinating 24 hours a day. So let me transition just to say a brief word about community hospital. After, of course, many months, a year of really prepping, community hospital is finally open. Very grateful to John Molina and MWN for their work. Very grateful to the state of California, from the governor to the Department of Health for the state, and our local team here, our nurses, our doctors, our health department, for this incredible achievement, including, of course, our own Long Beach City Council. And I want to especially thank Councilman Darryl Supernaw, who has been such a great advocate for this project. The hospital got their first patient yesterday, and now are receiving patients and will continue to receive patients in the days and weeks ahead. This hospital right now is essentially a 51-bed hospital that is receiving patients transfers from other hospitals to create room at other local hospitals. And we are very grateful for this hospital to be open, and it's really, really necessary. I want to remind folks, COVID-19 remains a serious threat. And as I turn this over to Kelly, I just want to note that we are losing people in our community at a faster rate than we have before. I think we are close, or we're about 440 folks that have died in our city. And if you remember just a week ago where we were and how quickly we've gotten to 440, we were just at 400, and we just lost another 40 people. And so that is serious, and it's something we've got to watch. As of today, there's 244 Long Beach residents that are hospitalized with COVID in our hospitals, and a total of 573 people with COVID in general that are in our hospitals, whether they're residents of ours or not. And so with that, I'm going to turn this over to Kelly Colopy, who will have some more to add.
Thank you, Mayor. I wanted to add to the vaccine conversation just a little bit. We've gotten a lot of questions about, when you're getting your vaccine, are we getting it out the door right away? What does all of this look like? And so I just wanted people to understand that we learn about how much vaccine we get each week for the following week. So we learn on a Tuesday what we're going to be able to get, and then on, we make sure that it's distributed in the places that need to be covered for our healthcare workers and our tiers, and then we make sure that it's distributed to them. You've been hearing a lot about the fact that there might be extra vaccine. To us, what extra vaccine means is you have a vial. The vial is only good for a short amount of time once it's been opened. If you have a couple left that's in that vial at the end of the day, then we are working to identify folks in the appropriate tier to be able to utilize that vaccine and to have sort of what we call an on-call list. We do have some vaccine on hand, but it's because we are preparing at this time to do all the COVID vaccine clinics that you're hearing about from the mayor, and we'll be moving quickly through those vaccine, and then also starting to focus on the second round, as those that were vaccinated in December in our hospitals, it's now time again already for them to start their second round starting next week. So we are planning for all those different things, and I just wanted people to understand when we talk about vaccine, extra vaccine is just what's left in a vial, and we want to make sure we use every dose that is possible. So I also wanted to share a little bit about the cases and where we are. So right now we have 36,696 cases. We had 1,032 cases reported today with 20 new deaths. And 244 people in the hospital. Our case rate remains 129 per 100,000 compared to we were at 6.9 at our lowest, and our positivity rate is 17.6%, and it was down at 2.9%, just a couple months ago. As the mayor has mentioned, the numbers have increased. So just for some perspective, so from March until December, we had just over 17,000 cases in the city of Long Beach. We now have well over 35,000 cases. This means that it took us 8 months to get to 17,000. It's taken us 1 month to do another 18,000 cases. That's how big and how widespread the pandemic is. In terms of our hospitalizations, on November 5th, we had 33 Long Beach residents in the hospital and 34 people overall in our local hospitals. On December 5th, so 1 month later, we had 97 Long Beach residents and 173 people in our area hospitals. We now have 244 Long Beach residents who are hospitalized a month later and 573 people in our area hospitals. If you go all the way back to the beginning of November, it's an 1,876% increase in our local area hospitals, and 230% of that has been just during the month of December. So we want to make sure that everybody really understands the impact and just the incredible scope of what is going on. The impacts on our hospitals has been incredibly difficult. You've been hearing about it. At this time, 85% of our ICU beds are filled. Of those, 64% are filled with people who are experiencing COVID. 70% of our non-ICU beds are also filled. So there's just impacts across. We hear a lot about ICU, but the regular beds are also much more full than they have been. We also have 79% of our ventilators in use, which is much higher than we've been experiencing. And then as the mayor discussed about our deaths in Long Beach, we had 282 deaths over 8 months until the beginning of December. We now have 440. 40 of those happened this past week. It's 158 deaths in 1 month due to COVID, and the numbers that we continue to receive continue to be high. So we're not seeing a decline in that. And so it's just so tragic. It's such a difficult time for our families and our friends and our communities, co-workers. We have seen 1 or 2 people in their 30s through 50s who had no known underlying health condition that this came from. So it's not just those underlying health conditions. And as I've shared before, an underlying health condition can be a really well-managed something that people, someone's leading a good life, and it just, and it has a strong impact on them. So given all that's going on, I want to share a little bit about what does it mean to do home care. So, we're thankful that not everybody ends up in the hospital and that you are staying at home. So symptoms do look different for everybody. Some people have almost no symptoms or a real mild illness. Others have very severe symptoms that may lead them to death. This leads to some people needing very extensive medical care, which we've discussed, but also there are many that have what we call mild illness. Mild illness may mean you have no symptoms, or it may mean that you actually feel like you have the flu, but it's still considered mild in terms of COVID. So when you're living at home and you're feeling sick with this, we ask you, if you not to go for medical support unless you feel like you absolutely need it, and that if you have tested positive and regardless of severity, that you get plenty of rest, you drink a lot of fluids, you eat healthy foods. You may consider there are some things like different vitamin D and zinc. There is discussion that can be helpful. Electrolytes. So to really just like the flu, really make sure that you're taking care of yourself. If you have fever or body aches, you would go to over-the-counter medicines like ibuprofen or acetaminophen. You can use a humidifier or a hot shower if you're having a sore throat. But remember, if you're having trouble breathing, that is a medical emergency, and we ask you to make sure that you seek medical care in that case. Monitor yourself completely when you're for any worsening of symptoms, and don't wait to call the doctor if you're concerned about the medical emergency. If you do live with someone who has tested positive or who has symptoms, it continues to be very important that you protect yourself and those around you. So if you're living with someone who's sick, you yourself should quarantine as well, which means stay home. Don't be out in the community. You only leave when it's essential, and that's pretty much for medical appointments. If you are a person who has tested positive and have symptoms, you must isolate at home, which means you stay home and you're separate from everyone, including those that you live with, if that's possible. And we know that's not possible for everybody. It's especially important for housemates who are at a higher risk of serious illness. So sick people should stay in a separate room and use a separate bathroom if possible. If this is not possible, then stay 6 feet away from each other, wear your masks as much as possible, and then increase your ventilation by opening windows or turning on your air conditioner if you have one, and purifiers or fans, but just to keep the air flowing. You want to make sure you wear your face covering as much as possible if you're unable to stay in a separate room, and then clean and disinfect all the surfaces as much as possible, but at least once a day. Wash your hands really well. Your household should see if you have friends or neighbors or family members or delivery services or whatever is possible who can bring you groceries, toiletries, medicines, and other essentials, every possible way for you to stay at home and safe. If you have questions about how to care for yourself or a family member, it's best to call your doctor first before visiting, as they can probably give you the advice you need over the telephone or through telehealth processes. And then, of course, you call 911 at the first sign of the difficulty of breathing, pressure or pain in your chest, your bluish lips or face, confusion or hard to wake, or other serious symptoms. You can find out more information on the LongBeach.gov, LongBeach/COVID-19 at LongBeach.gov. So the last thing I wanted to share with you is our community resources. So we have expanded our resource line by adding an online resource and referral platform to the COVID-19 website. This platform will help residents connect to our city and community programs that support you during the pandemic. Residents who need help with accessing food, housing, employment benefits, and other services can complete an online form available on the website. Our resource navigators will then use the information provided to connect individuals with appropriate service providers. The information provided on the platform is fully confidential. You can also get similar help by calling the resource line, which is 562-570-INFO or 570-4636, and pressing the number 5. So you want to make sure that knowing that number 5 is for the resource line. This is just one of the resources that's been made available through the CARES Act. Other services include services for our older adults, such as food, meal delivery, and case management, mental health services, services for individuals who've experienced domestic violence. You can find information on these services and the resource and referral form under the Assistance and Resources link at LongBeach.gov/COVID-19. So with that, I'm open for questions, and I'll turn it back to the mayor.
Thank you, Kelly. We will now take questions from the media. Media can ask one question. Follow-up questions can be taken at the Long Beach Joint Information Center. First question comes from Kelly at the Long Beach Post. Go ahead, Kelly.
Hi, this message is for Kelly. Kelly, you touched on this a little bit, but there's been coverage in the media about a large number of vaccine doses not being used or surplus. Can you give us a little better idea, number-wise, just on the percentage of surplus vaccines or the vaccines that aren't being used?
Yes, it is not considered surplus vaccine. At least we don't consider it surplus vaccine. Knowing that we do not get stable deliveries of vaccine, we are planning out with what we have and what we're hoping to be getting to be able to do all the vaccine clinics coming up. So all the vaccine that went to healthcare workers and hospitals, that went directly to them, and they are utilizing it. If if they did not utilize all of it due to the fact that certain people chose not to be vaccinated, vaccinated that were in the appropriate tier, they'll be utilizing that for the second dose. In terms of the other vaccine that we have on hand, we are starting healthcare worker clinics this week, and we had to be able to have enough over the time and the different deliveries to be able to open these daily vaccine clinics. So we don't see anything as a stockpiling or surplus. We see it as effective planning for ensuring that when we have large groups of people coming in, that they will be able to have access and we'll be able to make sure that they are covered.
All right, next question comes from Jason at the Long Beach Post. Go ahead, Jason.
Hi, this question is either for Kelly or the mayor. I'm not sure who wants to answer it, but there are a number of restaurants that have decided to stay open. One recently came under criticism for advertising a New Year's Eve party, and others are hosting protest zones. What does the city plan to do to ensure that businesses that are openly violating health orders fall into compliance? And do you guys have enough people on the team to ensure that happens?
We do have a venue task force who is contacting and engaging with businesses that have chosen not to follow the health orders. They receive different levels of fines, and if they choose to continue their operation after that time, we can be in a space where we either close them through taking their license, or maybe turning off the water or something that allows so that they are not allowed to operate.
Next question comes from Valerie at the Long Beach Post. Go ahead, Valerie.
Hey there. You kind of touched on that. This might be for Kelly or the mayor, but you kind of touched on earlier of reports of like LA firefighters and first responders declining the vaccine. Are you having any big issues with Long Beach first responders declining the vaccine? And then what is the city's plan if city workers and firefighters decline it, given the nature of their work?
So we're actually seeing a large uptake among our firefighters. We began vaccinating them yesterday, and we were able to make it through a third of our firefighters yesterday. They're going today. I don't have the numbers for today, but we're not seeing a high level of declination currently in our emergency service providers.
All right, next question is similar in nature, but for the mayor. This comes from Stephen at the Beachcomber. What mitigation, if any, has the city mandated for those employees who refuse the vaccine that are in public-facing jobs, like first responders?
Okay, I think the question was what's the city doing from a mitigation perspective if first responders choose not to get the vaccine? Is that what you said?
For employees who refuse the vaccine that are in
employees.
public-facing jobs.
Okay, so I mean, first, employees of the city of Long Beach just started getting the vaccine. I think our firefighters were the first ones to start getting them. And we have not yet seen any sort of major, or really, we have not seen folks not wanting to get vaccinated in a way that's, I think, bothersome to the health department. And so I think our goal right now is to encourage vaccination of all our city employees, and we hope that they will all get vaccinated when their time comes up. And so I don't know that that's an issue for us. Now, obviously, if we get to a place where we have large groups of employees or workers that are choosing not to, I think that's a conversation that the health department, our city team is starting to have, but we're really hopeful that we're not going to get there and that we'll be able to get everybody vaccinated safely.
Thank you, Mayor. This last question is for Kelly. Comes from Brandon at the Long Beach Post. Kelly, LA County hospitals, including those in Long Beach, are operating under contingency plans to deal with a surge in patients, but have not reached crisis care. With hospitals already overwhelmed, combined with recent holiday and New Year's gatherings, is it likely hospitals will have to enact crisis care protocols, and what would that look like?
At this time, we're working very hard to ensure that we don't reach the crisis care situation. We see that, that we have support systems from the state. We're working regionally, and the key focus here is really making sure to pull as much of the different things of staffing, oxygen, shifting nurse staffing levels, also opening their field hospitals. So the community hospital is very helpful for us in this, in terms of sort of stemming us reaching the crisis care point. So we do continue to do all we can so that we do not get into that point. And then if a hospital gets to that point, then they would notify us and we begin to work with them on the next steps.
Thank you, Kelly. That concludes questions. We will now move on to Spanish interpretation.
Muy buenas tardes, gracias por acompañarnos. Hoy es nuestro primer comunicado del año para el 6 de enero del 2021. Empezamos hoy el comunicado hablando sobre el conflicto en el Capitolio del país. Lo que están viendo en nuestras pantallas no representan los valores de este país. Nuestra ciudad manda buenos deseos a todos en presencia del caos y violencia. Seguimos con los datos generales de COVID-19. La transmisión comunitaria está por todos lados y en solo un mes nuestro recuento total de casos se duplicó de 17,550 el 4 de diciembre a 35,160 el 4 de enero. A la fecha, casi 37,000 residentes de Long Beach han dado positivo por COVID-19 y lamentablemente hemos perdido un total de 440 residentes de Long Beach a causa de COVID-19. Apenas la semana pasada estábamos alcanzando los 400 y ahora reportamos un total de 440 personas que han fallecido. Al día de hoy, 244 residentes de Long Beach están hospitalizados con COVID-19. Estos son personas que son residentes de Long Beach y están en un hospital aquí en Long Beach o en otros lugares. Y en total tenemos a 573 personas con COVID que están hospitalizadas en hospitales aquí de la área de Long Beach. El total de 573 personas puede incluir personas que son fuera de la ciudad de Long Beach, pero están en un hospital aquí en nuestra área. Los sistemas de salud regionales están presionados por el aumento de pacientes de COVID, pero esta semana el Community Hospital de Long Beach reabrió sus puertas y está aceptando transferencias de pacientes sin COVID desde hospitales y centros de enfermería local. Esto incluye no está aceptando pacientes sin cita previa. El primer paciente a ese hospital fue transferido ayer por la tarde. El paciente fue movido de College Medical Center en Long Beach a el hospital que fue recientemente reabierta, Community Hospital. Este hospital ofrecerá un total de 51 camillas, 11 de las cuales son de cuidados intensivos, que son muy necesarios. Los otros 40 serán para otros pacientes. Como hemos mencionado anteriormente, las camillas en las unidades de cuidados intensivos no solo se requieren para personas con COVID-19, sino quizá también aquellos que tengan un accidente automovilístico o un infarto también. Las camas en Community Hospital están destinadas a librar camas en otros hospitales y aliviar el estrés de los proveedores de atención médica que están operando al máximo o cerca de su capacidad. Todos nuestros equipos médicos son héroes y han estado trabajando sin descanso en la primera línea desde el primer día de esta pandemia del año pasado. No podemos agradecerles lo suficiente por el excelente trabajo que han estado ofreciendo. Ahora vamos a hablar un poco sobre la actualización del lanzamiento de la vacuna de COVID-19. Según las pautas estatales que seguimos aquí en la ciudad de Long Beach, las personas que son identificados por su grupo de fuerza laboral, eso significa que la administración de la vacuna se basa en el lugar donde trabaja y no en el lugar donde vive. Por ejemplo, si es usted una enfermera o doctora, y trabaja aquí en la ciudad de Long Beach, está considerado para recibir esa vacuna primero. Hace unas semanas comenzamos a administrar la vacuna COVID-19 a todo el personal de nuestros hospitales de Long Beach. Recuerden, si esas personas trabajan en Long Beach, aunque vivan en otro local, recibieron esa vacuna. Estamos en medio de la vacunación de paramédicos, técnicos de emergencias médicas y otros personales que brindan servicios médicos de emergencia, mientras que en el programa de farmacia federal están vacunando al personal y residentes en centros de atención a largo plazo. Recuerden que esos centros fueron los que tuvieron los números altos de COVID a principio de esta pandemia. Hasta ahora se han administrado un total de 7,486 vacunas en Long Beach, que incluye el programa de farmacias para esos centros de atención a largo plazo, y el 73% de los trabajadores de la salud de los hospitales, y estamos trabajando con otros proveedores de atención médica para evaluar las necesidades de vacunas para su fuerza laboral y coordinar esta distribución. La próxima semana y durante el mes de enero, la ciudad comenzará a vacunar a sectores e individuos en el nivel 1B, que incluye trabajadores de servicios de emergencia, personal de seguridad pública, como policía, por ejemplo, educación, maestros para aquí el distrito de Long Beach Unified School District, y sectores de servicios de alimentos, por ejemplo, aquellas personas que trabajan en Northgate o Albertsons, Ralph's, Villa Market, así como personas de 75 años o más. Aquellas personas de grupo 1A que no han recibido todavía su vacuna, por favor llame al área 562-570-4636. De manera proactiva, nuestro Departamento de Salud se está comunicando con los empleadores para coordinar una mayor distribución. Recuerde que va a ser su empleador el cual va a comunicarse con ustedes para notificarlos si van a recibir o cuándo vayan a recibir esa vacuna. Aquellas personas, por ejemplo, maestros del Distrito Escolar de Long Beach, van a recibir la notificación de su empleador, no de la ciudad. Esta es una implementación compleja, pero nos adherimos a las pautas estatales que están sujetas a cambios, y continuaremos compartiendo actualizaciones con usted regularmente. Vamos también a lanzar un portal de vacunas para el público en general, donde puede encontrar la información más reciente y registrarse para recibir una notificación cuando sea su turno de programar una cita para recibir esa vacuna de COVID-19. Se ofrecerán más detalles sobre esto la semana que viene. También, si usted es un residente aquí de la ciudad de Long Beach y es una maestra quizá en el Distrito Escolar de Los Ángeles o trabaja para un colegio fuera de la ciudad, puede contactarnos para ver si puede recibir esa vacuna bajo el nivel 1B. Mientras tanto, hable con su empleador o su médico si tiene más de 75 años para poder agarrar la vacuna para su grupo. Si tiene alguna pregunta, visite el sitio de web de la ciudad enviando un correo electrónico a covid19vaccine@longbeach.gov. Voy a deletrear eso, es COVID-19 V chica ACCINE@longbeach.gov. También puede llamar a área 562-570-INFO, INFO, que viene siendo 562-570-4636. Después de eso, presione el número 6 que lo llevará al lugar donde tiene que contactarse. Hoy también nos acompañó Kelly Colopy, la directora del Departamento de Salud y Servicios Humanos para la ciudad de Long Beach. Reiteró que nuestro número ha aumentado tremendamente desde el Día de Acción de Gracias en términos de casos, hospitalizaciones y también fallecimientos. Solo como perspectiva, desde marzo hasta diciembre tuvimos poco más de 17,000 casos positivos en la ciudad. Ahora tenemos más de 35,000 casos en tan solo un mes más. Eso significa que duplicamos 8 meses de casos solo en el mes más reciente de diciembre. En cuanto al hospital, el 5 de noviembre teníamos 33 residentes de Long Beach en el hospital y el 5 de diciembre ese número subió a 97 residentes de Long Beach que estaban internados y 173 personas en hospitales en nuestra zona. Ahora estamos en el mes de enero, tenemos 244 residentes de Long Beach internados por COVID-19 y en nuestros hospitales de la zona a 573 personas hospitalizadas. Esto es un aumento de 1,876% en los hospitales del área desde principios de noviembre y 230% de aumento desde el principio de diciembre. Los impactos en nuestros hospitales han sido increíblemente difíciles. En este momento, el 85% de las camillas en unidades de cuidados intensivos están ocupadas, de las cuales 68% son para pacientes de COVID-19. El 70% de todas nuestras camas que no son de cuidados intensivos también están ocupados y el 79% de ese 70% el 79% de nuestros ventiladores también están en uso, 79%. Esto es mucho más alto que los niveles que estábamos a principios de diciembre. Dado todo esto, queremos compartir un poco sobre atención domiciliaria, aquellas personas que no necesitan ser internados, pero quizás estén enfermos en casa. Los síntomas se ven muy diferentes para las personas. Hay aquellas personas que pueden tener el virus sin síntomas o quizá nomás una enfermedad muy leve, mientras otros requieren de hospitalización. Esto hace que algunas personas necesiten atención médica extensa, mientras que otras pueden recuperarse en casa. Y eso se clasifica como una enfermedad leve si está usted en casa. Para ser claros, muchas personas con la enfermedad de COVID-19 leve pueden también sentirse bastante enfermos. COVID-19 leve causa síntomas más severos que un resfriado o una gripe leve. Entonces se van a sentir más mal de lo que normalmente se sentirían con una gripa o la influencia anteriormente. Si usted o alguien con quien usted vive está muy enfermo y tiene síntomas leves de COVID-19, pero actualmente no necesita apoyo médico o hospitalizaciones, vamos a tener unas recomendaciones para ellos. Descanse lo suficiente y beba bastantes líquidos para no deshidratarse. Coma alimentos saludables y puede considerar complementar una dieta saludable con también bebidas para electrolitas, vitamina D y zinc, tomando también vitaminas. Si la fiebre o los dolores corporales le causan un malestar extremo, puede también tomar Tylenol o acetaminofén. Usar también un humidificador o tomar un baño caliente puede ayudar a aliviar el dolor de garganta o la tos para aquellas personas que quizás tengan tos. Recuerde que la dificultad para respirar es una emergencia médica, así que busque atención médica de inmediato si usted o alguien con quien usted vive tiene problemas para respirar. Controle si sus síntomas empeoran y por favor no espere llamar a su médico si tiene alguna emergencia médica. Si usted o alguien con quien vive ha dado positivo o tiene síntomas de COVID-19, es importante que se protejan mutuamente y protejan a la comunidad. Las personas que viven con alguien que están enfermos deben ponerse en cuarentena de otras personas de la comunidad. Eso significa salir de casa solo cuando sea absolutamente indispensario. Las personas enfermas deben aislarse en casa, lo que significa quedarse en casa y estar separado de otros, incluyendo a aquellos con los cuales ustedes viven. Si se permite y tienen otro baño, también se recomienda que usen un baño y no lo compartan, si es posible. Esto es especialmente importante para los compañeros de casa que corren un mayor riesgo de sufrir una enfermedad grave. Las personas enfermas deberían quedarse en una habitación separada y, como mencioné antes, usar un baño separado si es posible. Cuando no sea posible contar con habitaciones separadas, manténganse por lo menos 6 pies de distancia de los demás. Puede aumentar la ventilación en un espacio abriendo las ventanas, encendiendo acondicionadores de aire y purificadores o ventiladores en ese local. Use una cubierta para la cara tanto como sea posible, pero especialmente si no puede permanecer en una habitación separada. Las superficies deben limpiarse y desinfectarse lo tanto que sea posible, pero al menos una vez por día, usando aquellos químicos que son recomendados por el CDC para matar el virus, asegurándose de lavar bien las manos antes y después también de esa limpieza y evitar tocar la cara con las manos sin lavar. Su hogar debe ver si los amigos, vecinos o miembros de la familia que no viven con usted pueden ayudarlo a dar alimentos, artículos de medicinas y otras cosas esenciales. Entonces, si tiene algunos amigos, vecinos, miembros de familia que lo pueden asistir para no tener que salir, es mejor. Si tiene preguntas sobre cómo cuidarse a sí mismo o a un miembro de su familia, contacte a su proveedor médico antes de visitar un consultorio en persona. Es posible que lo puedan atender por teléfono. Y por supuesto, como siempre, llame al 911 a la primera señal de una emergencia que incluye dificultad para respirar, presión, o dolor en el pecho, labios o cara azuladas, confusión o dificultad para despertar o otros síntomas graves. Puede encontrar más información sobre cómo aislarse o ponerse en cuarentena en nuestro sitio de web de COVID-19. Vamos a hablar ahora sobre recursos comunitarios. Queremos compartir información sobre un recurso disponible para todos los residentes de la ciudad. Esta semana ampliamos nuestra línea de recursos agregando una plataforma de recursos y referencias en línea al sitio web de COVID-19. Esta plataforma ayudará a los residentes a conectarse con nuestra ciudad y los programas comunitarios que lo apoyan durante la pandemia. Los residentes que necesiten ayuda para acceder a alimentos, vivienda, beneficios de empleo y otros servicios pueden completar un formulario en línea disponible en nuestro sitio web, que les mencionaré en un momento. Nuestros navegadores de recursos utilizarán la información que ustedes les den para poder contactarlos con los servicios adecuados a los cuales ustedes necesitan. La información se dará en la plataforma que usted dará en esa plataforma es completamente confidencial. Los residentes también pueden obtener apoyo llamando al 562-570-4636 y presionando el número 5 en este instante para los recursos. Esto es solo un recurso que se ha puesto a disposición a través de la ley CARES Act que recibimos del gobierno. Otros servicios incluyen servicios para adultos mayores, como entrega de alimentos y comidas, y administración de casos, servicios de salud mental y servicios para personas que han experimentado violencia doméstica. Puede encontrar información sobre estos servicios y el formulario de recursos y referencias en el enlace de asistencia y recursos en el sitio www.longbeach.gov// COVID-19. Una vez más, es www.longbbeach.gov// COVID-19, COVID-19. De nuevo, también les comparto ese número para la línea de recursos, que es área 562-570-4636. Esto es todo por hoy. Muchas gracias por acompañarnos. That is all for today. We thank you for joining us. If you have reached us during the end of this press briefing during our Spanish translation, please visit our Facebook page to see Mayor Garcia and also our Director of Health, Kelly Colopy, with the information in English. Thank you so much, and we will see you next time.